Good morning, my dear students. Today I am going to explain chapter 5, which is related to drugs and the drug addiction. By the end of this video, the students must be able to cope with the following objectives: define the drug, list the 4 types of drugs, list the characteristics of a drug addiction, distinguish between endogenous and exogenous substances, and finally explain how cocaine, enkephalin, and morphine act. As an introduction to this chapter, one can say that drugs have been used throughout history by people in many societies. Frankly, the drugs have a huge negative impact on the activities of the nervous system that may lead to harmful consequences. Now, what are drugs? Basically, a drug, whether natural or synthetic, is a chemical substance which, when taken into the body, alters the body's function either physically and/or psychologically. Such drugs exert physical dependency, whereby the body becomes biologically adapted to a drug presence, and a psychic dependency, whereby the mind asks for more drugs to satisfy its behavior and gets rid of confusion. Actually, there are 4 types of drugs. Type 1, stimulants, like nicotine, that speeds up body metabolic rate. Type 2, depressants, like heroin, that induces muscle relaxation and retards thinking. Type 3, hallucinogen, like LSD, that provokes hallucination. And finally, type 4, opiates, like cocaine, that reduces pain and anxiety. As we all know that injecting drugs, chewing drugs, inhaling or smoking drugs can lead to very dangerous outcome, which is addiction. So, a drug addiction is a disease that affects person's brain and behavior and leads to an inability to control the use of drugs. Then, what characterizes a drug addiction? Basically, these are the characteristics of drug addiction. First, irresistible desire to obtain the drug no matter what the cost is. Number 2, tendency to continuously increase the dose to obtain the desired effect. Number 3, physical and/or psychic dependency. Finally, number 4, the individual's tendency to harm himself or herself and the society as well. Here, the chart studies the relation between drug dose and body response after first exposure and after repeated exposures to drugs. It's obvious that the response to first exposure attains maximum after a small drug dose, but after repeated exposures, more drug is needed to produce same maximum effect. Then, frequent usage of drugs leads to a state of tolerance. The drug may lose its effect, and the user must unceasingly raise the doses to obtain the desired effect. So, an overdose of any drug may lead to death. Now, let's explain the drug's mode of action. At the beginning, I must confirm the following fact. Drugs affect the normal functioning of neurotransmitters at the level of synapses. So, based on this fact, a relation is popped up between endogenous neurotransmitters that are normally synthesized inside the body and exogenous drug that artificially synthesized outside the body. If a neurotransmitter function is enhanced by the drug, then both the drug and the neurotransmitter are agonistic substances, while if the neurotransmitter function is inhibited or blocked by the drug, then both the drug and the neurotransmitter are antagonistic substances. Now, here's the big question: how is pain transmitted to brain? In fact, pain sensation is controlled by the three types of neurons shown in the figure. Type 1, presynaptic neuron. Type 2, postsynaptic neuron. And type 3, extremity of the modulatory neuron. Before we elaborate, I must furnish the following information. Enkephalin is an endogenous analgesic neurotransmitter, which is a normal pain relief produced inside the body. Substance P is an endogenous analgesic neurotransmitter, which is a normal pain inducer produced in the body as well. So, both enkephalin and P substance are antagonists. The arrival of action potential to presynaptic neuron provokes the release of P substance neurotransmitter molecules, which bind on postsynaptic neuron receptors and provokes pain sensation. Now, if enkephalin molecules are released from the extremity of the modulatory neuron and bind on their receptors on presynaptic neuron, then they stop the release of P substance from presynaptic neuron, and thus nervous messenger to postsynaptic neuron 2 is inhibited, which consequently permits less action potential to be transmitted to the brain and surely less pain feeling. Now, how is the scenario of pain relief with exogenous morphine displayed? Morphine as an exogenous substance and enkephalin as an endogenous substance act similarly towards prevention of P substance release. The action of morphine towards pain relief is summarized by the following steps. Morphine and cocaine have similar spatial configuration, that means the same three-dimensional structure. Morphine binds to enkephalin receptors. P substance vesicles remain unfused and stable. And finally, the whole scenario stops the release of P substance. Consequently, no action potential is transmitted to the brain, and thus no pain, and the person feels relaxed. Thus, morphine and enkephalin are agonists. Basically, morphine has a more durable action because the body cannot degrade it by specific enzymes. Now, let's observe how dopamine induces pleasure sensation. Basically, dopamine, once released from the presynaptic vesicles, it fixes for a short time on the receptors, then it is recaptured. This causes pleasure feeling for a short time. To understand the agonistic effect of cocaine on pleasure sensation, we must recognize its mode of action after its injection in the presynaptic cleft. Here are the steps that take place. Cocaine prevents the reuptake of dopamine. The molecules of dopamine released persist in the synaptic cleft. A larger amount of dopamine molecules will be bound to their specific receptors for a longer time, and finally, a stronger pleasure sensation is induced. And this shows how cocaine and dopamine are agonists.
you.